Is the audio and video clear? Can anybody just point out? Yeah, thank you. Thank you. In case of any issues, na, just give me a call because एक बार that Google Meet starts na, so that the background messages generally they are not able to attend. So afterwards, if I realize that somebody is not able to join, so it's very difficult. है ना? चलो, let's start. So guys, two things I had to share with you before we start off. These two things na, these syndromes and all the boundaries wala section जो है, which contains all the boundaries, all the triangles. This generally has I was having a lot of confusion when I had started my preparation. So what I suggestion ideas will be there. The first thing is that we have to go slowly, and keep on assimilating them the syndromes properly. Okay, and second thing is you can prepare a chart sort of something. Okay, it seems quite obsolete method, and if you make a chart something with the key points, like suppose Apert syndrome is there, so you just note down what type of mutation is there, FGFR2, what type of I'll request please can you mute your microphone? Yeah, thank you. Hello. So whatever syndromes are there, you have to write just one keyword, what mutation is there, and two clinical features. These two features will be classically present. And third thing is the images. Okay, just keep on flipping through the images. One thing, and second thing is the same image you put in Google. Okay, and after putting in Google, whatever top 2, 3, 4 images come, na, just make a habit of seeing them also, because it is not necessary that the single image which is given in Scott or in some other standard book will be coming. Okay, 90% chances are there that the same image will be there. Just a minute, one more. और कोई है? So please make a habit of going through the similar kind of images which are provided in Google. Top 2, 3 images, not more than that. Okay. So starting with today's discussion, we'll be focusing on two important aspects of your recent advances. One goes without saying, that is the laser. Second will be the stereotactic radiosurgery and touching upon the aspects of vestibular schwannoma per se. Okay, and apart from that, there are routine questions which have previously been asked, and second people which have the potential of being asked in the upcoming session. Okay, so coming to the first image, last time in the images of Tara Bichi, we saw the image of Dr. Tara Bichi. So here, when you see this gentleman, he is an Indian who invented one very fine thing which we all use in our OT. Okay, so the name of Patel. Yes, है ना? So the name of this gentleman is Kumar Patel. Yes, Kumar and Patel. Okay, and it goes without saying that his name is synonymous with which laser? CO2 laser. Yes. ये देखो नाम है. Just a minute, somebody else is trying to log in. More than 10 years. Okay, so his name is synonymous with CO2 laser. And see, again coming to the table of lasers, there are around 4 or 5 lasers which will be important to us. So I again request to make a table from this chapter. I'll request to mute your mic, it's causing a disturbance. Thank you. The second thing is, all the lasers per se, they will create a sort of confusion in your mind. So again, you make a table of all the 4 or 5 lasers which you use, CO2, argon laser, Nd:YAG, KTP, and उसके सामने उसका wavelength डालना है, because this is being asked. CO2 वाला तो it has already been asked lots and lots of number of times, 10,600 nanometer. Okay, so these 2, 3 things are the start questions. Now, generally, what happens in the Osce, 50% of the question you will be able to answer. Other 50% of the question you'll have to put in an effort. Like suppose this image comes, So you'll identify Kumar and Patel, you'll be given one marks. Second question will be what did he what did he invent, what is the wavelength of CO2 laser, where is CO2 laser used, that you'll be able to answer it properly. So 2 marks you'll get. Up remaining 3 marks, there can be the difficulty levels can be increased. So second question comes, what do you mean by laser safety? So all of us know that every object, everything has something good or something bad associated with it. So the lasers, basically they have lots of disadvantage associated with it. So to overcome that thing, there is certain laser safety protocols which has been laid out. So to reiterate it, I'll just important ones I'll reiterate, and other things will just add in the PDF. The first thing is, wherever the surgeries, the laser is being carried out, वहाँ पे outside the OT there should be a board which should signify that inside a laser surgery is being carried out. One, again somebody is there. I'll just okay. So wherever the surgery is being carried out, outside the OT, a board should be there displaying that the laser is in progress. Second thing, inside the OT, the people should be using protective goggles, and the tube should be there, which is being used by the anesthesia people. It should be laser safety tube, and the cuff should be covered with wet gauze and all. Okay. And coming to the things which are given in Scott Brown, same. Okay. So these 5 points are given in your Scott. Okay, the same thing is there, that the patient should be shielded. The tube should be laser safety, and the people should be wearing your protective goggles. And rest remaining things are continuing. Nothing else. Okay. Second thing, what do you mean by laser safety we have undergone? Now, what is this fluence threshold? Okay, so this fluence threshold is basically, this is the measurement. This is the measurement basically of the, basically every laser has some sort of energy, है ना? So this fluence threshold measures the lowest energy level. You have to note this word, lowest energy level of the laser, which is required so that it starts vaporizing the tissue. So basically, this tells us about the potency or how strong a laser is. Okay, two things. Now, this laser is important for your Osce purposes. It's a very important theory question also. So the people who are in third year as of now, the people who are preparing, who are in first year, who will be giving their FAT exam or they have given their exam, please make it a point. These 3-4 things are very important for you. Make a table of laser and stick it in front of your table so that in the coming weeks it should be imprinted in your mind, है ना? You shouldn't be able to recall. वहाँ पे confusion में you will not be able to recall कि 10,600 nanometer था क्या था. ठीक है? चलो, laser safety we have undertaken. Now coming to this question, this is actual Osce based question. Okay, so now I'll request the people to unmute your mic. Okay, and we'll start discussing this question. Okay, though this question gives us 3 instruments, and there are certain questions which are being asked. So the first one is the
perforator.
Yes, this is the perforator. Okay, this we all know. Second,
Skeeters.
Skeeter is the C. Third one is the skeeter.
Skeeter.
ठीक है? See, skeeter has been asked 2-3 number of times. ठीक है? So just don't forget this image. This looks entirely different. You will not forget. Now second वाला है, that is the confusing thing. This name is the Larkin. Its name is Larkin and Burr. ठीक है? So that's what I was telling. Ki don't get like bogged down. Ki I don't know all the three answers. DNB knows that you have to know this A and C. B is the confusing part. 90% of the people will not know. Even I, if I would have been there, anybody would have been there. They would have to know a second thought. I also searched it from Google. Okay. The second question. Now this is an easy one. Name the surgical procedure where they are used. We all know that. Stapes surgery we can answer. Yeah, lovely. And the third is mention the no contact tool. We just studied.
Laser.
We just studied the laser. अच्छा, laser से फिर से one more question. Acronym. Laser is again a short form. So you should be able to answer, sir. It is light amplification by stimulated emission of radiation. ठीक है? तो laser का full form and principle of laser you shouldn't forget. It can be a potential 1 marks Osce question, and the people who are preparing for your theory, it can be a potential theory question as well. Okay. So enumerate 4 intraoperative complications of the procedure. So we all know STP surgery, everybody has studied. So I'm just going the point wise. Like if such a question is asked, you have to specifically answer intraoperative complications. So intraoperative complications can be right from your tearing of your tympanomeatal flap to the subluxation of incus to a perilymph oblique, a CSF gusher or a floating foot plate. All kinds of things can be there. Got my point? Any confusion of to anybody of all these 4 questions? Lovely. Can we proceed further? So please, Skeeter का photo नहीं भूलना है. Skeeter is very important. A, everybody knows perforator, and B is Larkins. ठीक है? The name, try to remember it. You will remember it. Okay. And when we'll discuss this otology, we'll slowly add surgeries also, discussing surgeries in daily classes. So then we'll discuss the important points of stapes surgery also. Now again, this is again a question of real life Osce question. See, in real question, what happens na? You are able to see this thing. Yeah. Are you able to see my red pointer? है ना? So when the question comes, it starts backward from 4 minutes. So the time till the time you read the question, your 1 minute and 2 minutes are over. ठीक है? So you have to be quick in assessing the questions and try to answer all the questions. It's not like if you answer everything in one point, you'll be given all the marks. No, it is hard. It is divided. Now coming to this question, can you see this image? So what is the most likely diagnosis? Can I have any
CP angle tumor schwannoma.
Likely.
Vestibular schwannoma.
Likely vestibular schwannoma. And what is the sign which you see? This is a classical sign. So the answer goes as
Ice cream appearance.
yeah, lovely. Please treat yourself with ice cream daily. Okay. Now coming to the third thing, what is the contrast which is used in the scan? The contrast is
Gadolinium.
ठीक है. Got my point? Acha. Now this SRS we are just going to discuss in the upcoming slides. So I'll not just focus it over here. Now see, image you have seen. Now I'll just show you the similar image. This is given in your Scott Brown. ठीक है? ये Scott Brown से मैंने screenshot लिया. So that's why I keep on repeating. Please don't miss any image of your Scott Brown. ठीक है? That can be asked anytime in your Osce question when you'll be preparing for your SS examination. The same thing is Scott Brown. You have to learn it. Okay? So same image is there for your vestibular schwannoma. Acha. Now again we have a named curve in the chapter of vestibular schwannoma. Please remember the name of this curve. ठीक है? The name of this curve is Nelson-Allen curve of the growth. Okay? So there are 2 growth curves which are important for you. This one in the vestibular schwannoma, and the second is I keep on reiterating the important points. There is a curve by the name of Kaplan-Meier. ठीक है? So when we'll be studying the statistics, or whenever you are free time, just drop in Google, just put it in YouTube. What is the Kaplan-Meier curve? What is the importance? So it is forest. Yeah, and third is forest curve. बिल्कुल yes. है ना? So these 3-4 things are there, so you shouldn't forget it. So name please remember, Nelson-Allen curve of the growth. Now coming to this, the question which was there, what is SRS? What is your stereotactic radiosurgery? So basically it's a technique which involves some sort of coordinates and enables a precise location of the tumor. It helps us to target the precise location of the tumor. And what happens when we know the location of the enemy? We target them. So there is targeting of radiotherapy treatment. Okay, so my point is to make you understand over here the words, the keywords which you have to write in your exam. I'll type it and send it to you when I'll send the PDF. But my point. Acha. The second question is they will ask you what is the difference between SRS and SRT. Matlab, stereotactic radiosurgery and stereotactic radiotherapy. What is the main difference? I just want to know one difference.
SRS में you give the treatment one मतलब एक ही बार में देते हो और
Yes.
SRT में 5 आप एक episodes decide कर लेते हो कि मैं
बिल्कुल है ना. So it's just like the treatment of medicine and surgery. The patient comes to you for surgery, you take him for surgery, one and all. एक बार उसको surgery के लिए ले लिया. And what happens in medicine? They will come to you again and again. So that is the main difference. That the dose of radiation is delivered in a single treatment in SRS, and it is delivered in different several fractions. Guys, this was my fat question when I gave my exam. So I never forget this question. The difference क्या होता है? That time I was not even aware in first year कि SRS क्या होता है? What is SRS? Let alone handle the second question, difference. So please, this is a potential question. Okay. Now in SRS part, there are two names which are given in your Scott Brown and important to you also. Yeah. Okay. So there are two main differences: cyber knife and gamma knife. Okay. So basically, see how I had learned it. I'll just try to reiterate in that way. You can assimilate in your own ways. See, the one thing is wherever the name comes cyber. So cyber, it makes us think that there is something very modern or very new type of thing which is happening. Cyber crime, cyber thriller, something sort of that sort. And gamma is like something old fellow. So in gamma, what happens? There is a rigid stereotactic frame which is attached या fixed to the head. Okay? जबकि यहाँ पे there is no need of any head frame. No need of any head frame. So this is, as far as your Osce point wise goes, this is one of the main differences. And second thing is, since the cyber knife being more precise, it is used in your intracranial as well as your spine tumors also. जबकि ये वाला सिर्फ intracranial के लिए है. This is old, so it is used only for intracranial. Okay, and the thing is, one more thing. The difference between cyber knife and I'll mention it. One question which has already been asked: what is the size of the tumor till which you will apply SRS? So SRS is applied
3 centimeters,
less than 3 centimeter in diameter. Don't forget this number, please. It's an important question. Okay. And now after this, what happens? They will ask you what is the dose which you will give in the vestibular schwannoma. Okay. So please remember the dose. This is 12 to 16 gray. Got my point? And there can be two other questions which can be asked again from your Scott Brown. What do you mean by pseudo progression? Pseudo progression. They can ask you. They can give you a similar sort of image. They can give you an image of some cyber knife, okay, and they can ask you what is the size of the tumor with which you will proceed, what is the treatment duration and the dose, and what do you mean by pseudo progression. So what happens is, following the stereotactic radiosurgery, there is a transient enlargement of the tumor. Matlab, after surgery, you will see that the size of the tumor has increased. Okay, and which will ultimately, in due course of time, 3 months, 6 months, it becomes stable and it might regress. Therefore, it is called as pseudo. So, what is the meaning of pseudo? That this is a false sort of progression. Okay, so don't forget this. One more question which can be asked, again a short form. What is RION? So RION stands for radiation induced optic neuropathy. ठीक है? So what one thing they can ask you extra कि भैया RON कब होगा? What radiation dose you will give? What is the harmful dose of radiation after which this thing can be caused? So after 8 grays पे. These are known complications. Got my point? So these all questions can be given to you. Now, again coming to one question, कि so and so year, So far so good, everybody?
Yes, sir.
Okay, dear. ठीक है. Now again proceeding to the another spectrum of this disease. ठीक है. They'll give you some sort of history that itna year old patient came to you with complaints of this sort of plaque-like skin lesions. There were some subcutaneous schwannoma, and then you did a contrast glance MRI for the patient, and this is the MRI scan of the patient. Now they will give you some good questions. So what they can give you? Key identify. First question. So can anybody give it a try?
Neurofibromatosis type 2.
NF2. NF2. NF के बाद 2 लिखना बहुत important है, ठीक है? Don't forget it. So this is a characteristic. Wherever you have this bilateral, हाँ? ये bilateral vestibular schwannoma, तो your horses of your mind should go towards this direction. Okay, so don't forget this thing. Now in NF2, what extra they can ask you? They can ask you the treatment modalities. Okay, they can ask you screening protocol. Okay? And any newer sort of management, new management. Okay, so coming to the same thing, and there is a diagnostic criteria as well. Okay, so please go through this diagnostic criteria. This is from your SCOT itself, so please go through this thing. Okay, so it's called as Manchester's criteria. See, at the end of your third year, when you are preparing for your exam, there are around 50-60 criteria. So the person gets confused that which criteria is used for classifying what thing, let alone knowing the details. So try going through this, okay? And after this, what screening will you use? Okay?
Annual audio test.
Yeah, and so you can classify it in your audiological as well as MRI investigation. So ideally you should use the word your MRI, and this should start, MRI screening should start at the 10 years of age. Okay? Not possible in our country. You cannot explain the parents of the patient, but this is what the guidelines are, and MRI should be done
every 2 years.
Yeah, every 2 years if the patient is under 20 years of age, and every 3 years if he is under 30 years of age. Okay? So please don't forget the screening protocol. Okay, so NF2 again, people who are in first year and in third year, people who will be giving your theory exams, NF2 is very, 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 very important. Don't forget it. Chalo. Ab see, how is this drug related to the things which we studied? Okay, you will be getting one drug for sure in your out of your 20 OSCEs, एक drug होगा उसमें, ठीक है? So whenever you are studying, तो उसका जो related drugs होगा, try reading about it. ठीक है? So the drug which is there, this is bevacizumab. Okay?
Anti-VEGF.
Yeah, anti-VEGF.
Monoclonal antibody.
Yeah. ठीक है? So this is vascular endothelial growth factor inhibitor. अभी इसको use कहाँ पे करते हैं?
Recurrent respiratory papillomatosis.
There are एक तो अभी हम लोगों ने पढ़ा, this is used in NF2 also. ठीक है? So that's why I had included it. ठीक है? So whenever you read NF2, so your mind should work. कि भैया the answers में, if somebody asks me answer, so I'll write about cochlear implant and ABI also. And in the recent management, there is a drug called as bevacizumab. So whether the question is asked from the drug section or it is asked from your recent advances, the answers remains the same. Okay? Apart from that, इसके अलावा जो हो गया आपका, it can be used in your glioblastoma, non-small cell lung carcinoma, renal carcinoma, colorectal carcinoma. You can answer all those things. But NF2 should be there. Got my point? Chalo. So far so good. Chalo. We shall proceed further. Now coming to some important advanced questions. So coming to this thing, we identify this instrument as. Can somebody answer? This is a Cial endoscope.
Cial endoscope.
Okay. I'll forward some related data of Cial endoscopy and video fluoroscopies and all. The people who are interested to read more can go through that. So you can identify this thing. And coming to this thing, this is your irrigation channel. And from here you can do your intervention and all. So what can be the complications associated with this procedure? There can be, there can be stricture formation, there can be ductal perforation, injury to the duct, there can be infection, there can be swelling, all those things can be asked. Okay, now these two are the common questions. Okay, after this there can be a question, related question, whatever related questions of CL endoscopy, your parotid, and all those things can be asked. They can ask you anything, right from your anatomy to any recent advances. They might ask you, ki, bhaiya, what are the markers of facial nerve in parotid surgery? ठीक है? They can ask you what is the anatomy of parotid nerve. ठीक है? Anything all of these sorts. So be prepared that out of 3-4 questions, 2 to 3 you will be able to answer. One question might be a bouncer. Don't get panic. Don't panic at all. Okay, write whatever you know and then fill it. Even if you don't know anything, fill anything in point wise. ठीक है? So possible questions will be markers of facial nerve and parotid nerve. ठीक है? Parotid के surfaces पूछ सकते हैं. Anatomy of parotid. So parotid has 3 surfaces. One is superficial, second is your anteromedial, and third is your posteromedial. ठीक है? अच्छा, coming to the next question. ठीक है? Coming to the next question. What are they asking to us? ठीक है, what are the parts of this thing? So parts, there's no fun in telling, we know this thing. This is phalanges. This is your cuff. ठीक है, this is called as your eyelet or balloon. This is your obturator. And this is your cannula. ठीक है? Now, second question goes, why is tracheostomy difficult in a pediatric patient? Okay, so we all know that in pediatric patient there is a large head to body ratio. है ना? There is large head to body ratio. Okay, there is prominent occipital region. So because of these things, both like intubation as well as track is different in a pediatric patient. And here only I'll just like to mention a question. Difference between adult and pediatric. Temporal bone, mandible, larynx. ठीक है? It's an important set of questions. Please remember them in a set together. कि temporal bone पूछेंगे तो we should know that 3-4 differences in both of them. Mandible में what are the differences that we should be knowing, and same goes for your larynx. अच्छा. Now again, this question I'll request anybody gives it a try. What protocol we will use for decannulation?
Great hormone state.
Yeah, great hormone street protocol. Okay, so there is a possibility that nobody will ask you inside कि भैया इसके अंदर करते क्या है. Nobody will ask you कि what, how do you decannulate. You keep on doing whatever you do in your ward, however you have been taught. But the name, if somebody asks you कि how do you follow, you should remember the name. So the name goes as great hormone. I'd like to recall one incident associated with this question. Like we were doing all the routine ward works by the end of, I think it was first year end or second year starting. One of like our new HOD came and he asked, how do you decannulate the patient? So we told him, sir, we put a cork inside it, we downsize the tube, and when everything is okay, we pull out. So he said, do you follow any protocol? So like we were like, sir, this is the only protocol which we follow. We do not know this name. So the thing is, you should be uttering the name first. You can do whatever you want. Okay. Chalo, coming to the next tracheostomy tube. Can anybody identify these tubes? These are same tube, different images. One different thing is there. Can you see this? Okay. So the name of this tube is
Why
Vona. Yeah. Yeah.
It has adjustable flange.
Yes. It has adjustable neck flange. ठीक है? Adjustable neck flange. And what is the advantage? Now, what are the remaining questions they can ask you? Via, what are the advantages of this tube? So you should be telling that, sir, it is adjustable for difficult anatomy, for obese patient, any trauma patient. You
Neck
can do it.
muscles.
Yeah, definitely. And one thing you should remember, whether this tube is advised for long term. Okay? This is your temporary measure. Okay, this should not be used for long term. Okay, and one more point about this tube, which can be asked, that the shaft of this tube is basically a reinforced wire. They might ask you, what is the one special characteristic of the shaft of this tube? So this shaft is made up of a reinforced wire, which prevents kinking. Okay? So don't forget the image of this tube. Bivona adjustable neck phalanges tube. Okay, so far so good. Now, coming to this thing. Okay? Our favorite eardrop?
Solivax.
Now coming to the components. Chalo.
Prochlorperazine.
हाँ बोलो
Prochlorparabenzoane.
हाँ चलो गूगल करो सब लोग. ठीक है. See, it is para-dichlorobenzene. ठीक है. So these are the confusing things. You will be like, na, here I have seen this thing, I know this thing, but when we come to write the answer, we'll like somehow there will be problem. Okay, so 2-3 components are there which you should remember. The one is chlorbutal. The second one is as para-dichlorobenzene. There is turpentine oil and benzocaine also. Okay? Now, second question goes as, name some water-based ceremenolytics. Okay? So, water-based ceremenolytics में 2-3 names you can remember, that will be fine. The first one goes as 2.5% acetic acid. Okay? Second is your 3% H2O2. And when you don't have anything, so you can also go with water plus saline. Okay, so apart from this, what else they can ask? They can ask you, name some topical steroid preparations used in otology. So you should be able to answer betamethasone, clobetasol, triamcinolone. And one advice which I want to give you, abhi to we have around 1 month. So if these sort of questions are there, suppose the question goes as, name some topical steroid preparations. So rather than answering only betamethasone, try to answer betamethasone dipropionate. Okay, rather than answering only mometasone ointment, try to answer mometasone furoate. Getting my point? So these are the things which will fetch you full marks in your OSCE. Full marks matlab, agar this question is of say 5 marks, so if you will write betamethasone and mometasone only, okay, so what happens in your OSCE, let me tell you, they immediately take your paper after your OSCE, they will click a picture of that, make a PDF and send it to NBE. So when it goes to the NBE, it depends upon the mood of the person who is checking your sheet, because they are given some keywords that you have to find this keyword. So if he's a happy man and you have written dimethasone and mometasone, he'll give you 1 mark full. But if that guy is a constipated guy who has been stressed all his life, so he will be like, feel happy. Okay, this resident, this Dr. Saab has not written this dipropionate and furoate. Let me cut his marks. So he might either give you half marks or even less than that marks. Okay. So believe me guys, DNB is known for its toxicity. People are like, they will give you very good in your practicals, and then they will give you very less marks. Okay, chalo. So far so good. Moving ahead. Guys, identify this device. Don't bring any other thoughts in your mind. I'll give you another image of this here. Now,
वर्मिन कैलिपर सॉर्ट कंटेंट.
good. ठीक है.
Still
Now,
mouth tag.
yeah, now you will not forget. ठीक है. Dr. Shivam ना?
Yes sir.
Good भाई, बहुत बढ़िया. ठीक है. See, image you shouldn't forget now. ठीक है. The name of this image goes as, see, now what happens is, even if you are not knowing the exact component of this, like what is the exact name, ठीक है, so if you go to the questions, identify, and second question is grades of Christmas. Okay, so now your mind should start working that how, if possible, this image has something to do with some Christmas sort of thing. Okay, so अगर तेरे को, like if you are, हाँ, so see, the answer of this thing is goes as threaded. I'll just write the answer and then I'll tell you one thing. Threaded, tapered, screw. ठीक है? This is used for Christmas. See guys, see, if you will leave the question empty, so definitely you are going to get 0 marks for that question. Okay, so even if you don't know anything about this answer, so how I would have given it, कि sir it is a Christmas management device. Like जैसे हमने in the last of we saw it as something like mandibular advancement device used for OSA. So on that ground you should write it. अगर if you don't know the exact answer, but don't leave anything empty. Getting my point? Please don't leave anything empty. Now, what are the grades of trismus? Okay, so grades of trismus में, if the mouth opening is 30 to 40 mm, this is mild. Okay. 15 to 30 mm, moderate. Okay, and if less than 15, severe trismus. Okay, and apart from this trismus, let me write one thing. Please read about muscles of mastication. ठीक है, it's important from the exam point of view. As in routine practice, all these things generally goes to the dental setup, but in exam point of view, they can ask you these type of questions that what is the origin and insertion of masseter muscle, insertion of your medial and lateral pterygoids. So you shouldn't be like taken exactly unaware. Oh, I forgot to study. Okay, so you should write at least something about them. Okay. So this device, and see one more thing, when I checked Google, so I saw this thing also. Again, see, it's looking like those clips which we used for hanging our clothes. Okay, but again it's a mouth opening device which we use for your trismus wala part. ठीक है? चलो, so far so good. Coming ahead, guys, COVID and mucormycosis will not leave you in your exams also. Please read everything possible about COVID vaccines and mucormycosis. Okay? Please, it's a humble request. You will be benefited by this, whether in your Viva or in some or how or the other. Please read about it. Now, these are some sort of questions which are there. How are viral vaccines classified? And they are asking you examples of some viral vector vaccines and genetic vaccines. Okay, so these viral vaccines, they are classified, coming down, ठीक है. So these are divided into all these 5 type of things: viral vector, genetic vector, inactivated, attenuated, and protein vaccines. Okay, and when we try to classify them further, so in the viral vector vaccines, you should remember 2 names. First is the Covishield, which most of us took. Okay, apart from that, second is your Janssen. Third is your Sputnik, the Russian vaccine, and apart from that, AstraZeneca is also viral vector vaccine. And two names you should remember. Any two names you can learn. In the genetic COVID vaccines, you have the Pfizer one and the Moderna one. Okay, guys. Achha, here only I'll write it again. Please discuss. We'll read about it. We'll discuss about it. ठीक है? COVID vaccines. Third is your mucormycosis. ठीक है? Along with its management. Surgical management generally there is not much fancy stuff to be asked in the Osce stuff, but whatever the medical management is there, whatever treatment which was being given, all those things have a lot of potential Osces. So we will discuss these things in the section of upcoming things. And apart from this, third thing which I would like to request you is TB. Okay? So whenever you find this thing, TB in ear, TB in larynx, TB in nose, granulomatous condition of nose. So in all those conditions, please this thing will be asked. And the people who are still in first year and third year, please go through these things. TB larynx, otitis media, they are very important questions. Okay, chalo. From here, whatever I had prepared, I've finished it off. I've had around 10 to 15 questions. We will revise these things, and whatever 20-30 things are there, and around 4-5 points which are left behind of recent advanced section, they will be revised when we'll revise the recent advances thing. Okay, so I'll request people. I got these messages that there are many people who are in first year. Okay, so for them, I'll just request, please read about parotid bay, pleomorphic adenoma, and Warden's. 5 points, not more than that. 5 points. Okay? We'll share important things of both the tumors. But I'll request before the next class, which is on next Monday, please read about pleomorphic adenoma, 5 points, and 5 points about Warden's. And coming to the HPE part, this is my dreaded thing. Like when I was studying, I was just hating these HPE images. So what I thought to include in the this Osce pattern, 1 image per day. So yesterday we received inverted papilloma. So guys, I'll request you, please go through the inverted papilloma, and people who are preparing for theory as well, they should also prepare their answer of this inverted papilloma. And people for your Osce's, this is very important. So you shouldn't leave that now when I'll study inverted papilloma, when I will be studying the nose case. No dear. Whenever you are doing one question, do all the parallel questions which can be asked. What is the gross image? What are the names of the question that we all discussed? Okay, so please keep on revising. So it will be very easy when we will discuss the nose case. Like when we'll discuss the nose case, please, sir, what is the DD? So as soon as you utter this word inverted papilloma, you can pull the examiner to the desired cause. When we'll be discussing case discussions, so I'll try to put these things into your mind, that how to answer in Viva, because this is a very important question. I must tell you guys, these are two different things. Knowing something and making the examiner know that you know. These are two different things. You might be a king of your domain, but if you are not able to make the examiner understand, so dear, that is a worthless fruit. This examiner will not give you marks. So you have to play in such a way, you have to put such keywords so that the examiner falls into that trap. Okay, so whenever, example, you have studied the inverted papilloma sort of thing, okay, and whenever you are being asked in the question, so you should utter, sir, the mass is bleeding on touch, it can be inverted papilloma, and then stop, give it a pause, say 5 seconds pause, and examiner will, acha, why did you say inverted papilloma? Tell me about something about it. So now you can start vomiting. Okay, but it shouldn't happen that you have studied JNA and you are answering about inverted papilloma. So that is altogether different ballgame. So after this inverted papilloma, second thing which we'll go about is rhinoscleroma. Kal ki image mein we'll be getting rhinoscleroma. So please prepare about rhinoscleroma tomorrow, not today. ठीक है, I'll put this discussion, and I have tried to record this thing separately because many people had requested the recording of this thing, but somehow I tried all the things, Google Meet, Zoom, Microsoft Teams and all, but audio and video were not getting recorded like in one go. So I've recorded video separately and I've recorded audio separately. I'll try to merge it and put it in a formatted way by tomorrow. Let's see how it works about. I'll let you know. Okay, so any doubts guys for today's class? जितना आपने around 10 to 15 points पढ़े हैं. And if no doubt is from that thing, any inputs from your side, please feel free to share. If you want